Okay, so for respiratory system, by inspection, the patient has normal standing type of chest, and there's absence of any deformities on the chest. And by inspection, the patient is using abdominal type of breathing, and in the nasal cavity, I can see singeing in the nasal vibrissae, and also the patient nasal wing is participating during his inspiration, indicate there is dyspnea, and there's also muscle retraction during respiration, and patient can say ah. Okay, so there's hoarseness in the patient's voice, and also presence of carbonaceous sputum. So palpation, do you feel pain?
No.
Okay, so patient doesn't feel pain during palpation, and also there's absence of subcutaneous emphysema or any fracture or tenderness. So say ah. Okay, so the vocal parameters is decreased, and okay, so the elasticity of chest is also decreased. Okay. So the respiratory rate of patient is 22. It's a bit tachypneic. And okay, the trachea is in the midline. It is not displaced. Okay. So by percussion, the border of the lung is normal. So also there's a bit of dull sound in the lower lung. And now auscultation. Okay. Patient, please breathe in and breathe out. So by auscultation, there's decrease in breathing sound, and there's also wheezing. The respiratory system is compromised, so patients have signs like tachypnea with a 22 breath per minute rate, and also signs of dyspnea. And also patients also have signs like singeing of nasal vibrissae, hoarseness in voice, presence of carbonaceous sputum, and also wheezing. Based on the patient's case history, and the presented symptoms, patient is suspected to have inhalational injury causing by the thermal burns. And for further confirmation of the diagnosis, a bronchoscopy is needed to diagnose the inhalational injury, and also screening tests like chest x-ray is also needed. If patient have been diagnosed through bronchoscopy where patient have inhalational injuries, a frequent and close evaluation of the vital signs such as the respiratory rate, pulse oximetry is needed, and securing of airway is very important. So high flow oxygen therapy is needed for the patient to maintain a high oxygen saturation level for at least 90%. And if the respiratory rate decrease, when necessary, intubation is also needed. And for further laboratory examinations like blood gas coefficient and sputum examination is also needed. And if there's too much sputum, to decrease the secretion of the sputum, mucolytics can be prescribed. And if mucolytics are not effective, so nasal tracheal suctioning will be done, and bronchodilators are also needed to prevent patient experiencing bronchospasm. And for patients with inhalational injuries, they are more prone to develop complications as like nosocomial pneumonia, ARDS, atelectasis, pulmonary edema, COPD, and bronchial asthma. So for recovery of patient, incentive spirometry is recommended to train their lung functioning capacity.